Hi, my name is Alex Hayes. In this video, I'm going to teach you how to start an IV. I'm going to show you by starting an IV on myself and guiding you through the steps of what I do every day, starting IV lines on patients, and see if I can give you tips or pointers to help you become better at starting IVs. Alright, let's get started. Alright, this is everything that you should need to start just an IV. You've got the flush here on the right, and in the center you've got the 20 gauge IV. They color coordinate them so you know what size it is just by looking at the color. So if it's already in someone's arm, you know what size it is because of the color. I think just about all the brands use the same colors, so it's universal and people know. And then here on the very left, we have an IV starter kit, and this is... Alright, so we got all our stuff out. The IV, the flush, the IV starter kit that has everything else you need in it. The next thing to do is just find a vein. So the best place to put an IV is obviously the forearm, because if it's in the AC or the bend of the elbow, the patient bends their arm, it doesn't flow in as well and it might stop. And I know even the OR and the anesthesiologist like it in the forearm, so because if the patient's going to surgery, you don't know what position their arm might be in, just depending on what they're doing. So we want to find one that's nice and straight in the forearm. And lucky for me, I have really good, easy veins, which not all patients do. So first, when you find a vein, if you can already see it, the best thing to do is fill it. If it's got a nice rebound bounce, that's a good vein, because sometimes patients' veins just flatten out, but you can really feel, if you fill the area around it, it's just more solid. It doesn't feel like a vein. You'll get used to feeling that. And I just use one finger and you can just bounce around on it. So we're gonna do this one right here, because it's nice and straight. That has the rebound pressure. So that's what we're gonna do. So I'm gonna use this alcohol prep pad first. Just helps clear off some of that outer layer of skin. Get some of the oil off too. And then we have our ChloroPrep pad. Just another secondary cleaner. If I pump my fists, these start to pop up a little bit more too. And then next we have our IV. So when I pull it out, I always like to break this seal and just retract the needle back a little bit, because it kind of sticks when you first do it, so just better get that out of the way before you have the needle on someone's arm. And then next, when you know where you're going to put it, you want to make sure you fill out how it anchored, how their skin is when you anchor the vein down. It's one of the biggest mistakes that people do is they don't anchor the skin down in the vein, so they put it in there and it doesn't go as smoothly. It's like trying to put a needle through like some kind of fabric. If you don't hold the fabric tight, it's going to be a lot harder to push it through. So since I'm doing it with one hand, I'm going to use these fingers to anchor the skin. And everyone's body's different depending on what age they are. So people with looser skin, you really have to get it anchored down, but not enough that it flattens out the vein, because you can do that. So, and another thing is, a lot of people like to put it in super fast and just harpoon it in there. I don't do that, because if you just anchor the skin down nice and tighten it out, it'll slip right in, and usually that's pretty painless compared to just pushing it in there super quick. So now we have our vein. Hopefully you guys can see. Anchor it down with these fingers, and I'm going to push it in right here. Oh, see, we have a flash. I'm going to push it in just a little bit further to make sure it's all the way in. And then I retract the needle and it'll start coming down this line right here. That's how you know it's in. And the further you pull the needle out, the faster it'll go. Well, we're going to thread it in all the way. So this needle's out. You can see it in there. And now I can pop the needle out all the way and push it in just the last little bit. These needles are nice because you can't poke yourself. You literally have to take a hammer and bust this plastic off to get that out. It squeegees all the blood off this. so it doesn't drip anywhere. But obviously this is still a sharp, so you gotta throw it in a sharps container. See, and now we have it in. So the next thing we need to do, well, this is what I like to do first. When I get it in and I know it's in, secure it down. Because sometimes patients can be really sick and out of it and they don't know what's going on. And they might move their arm and you may be drawing blood out of this IV first before you secure it, and the patient just yanks the whole IV out of their arm. And it's not their fault. Maybe they're a liver failure patient and their ammonia's through the roof and they have no idea what's going on around them, or plenty of other scenarios. So we just lay that tegaderm on like that. It's better if there's not a lot of hair around there. That's why I shave my arm, so it sticks better. Just get it on there nice. So now we know it's secure. It's not going to go anywhere. And then we have to take this cap. We'll clamp this because we got to put the saline flush with the cap on it, just like this one. Clamp. Sorry, you can't really see because I'm out of the screen. Put that over there. Now this is going to be the tricky part because I don't have an assistant. So now I have it like this. This whole area is pretty clean because I just cleaned the whole area on purpose. But now I'm not touching anything else with this. This hasn't touched anything. Just want to screw that in like that. And we want to unclamp it. And now we can just flush it in. See how it flushes. And if it started to bubble up right here, obviously you're not in the vein. But now it's just flushing in, and we can flush a full like 10 cc's. And you can even pull it back a little bit and see how it draws back in. And now I can flush the rest of it in. And the best thing to do, I can't really do it with one hand, is, hold on, oh, just clamp it. When you're flushing, you want to flush till it's all the way clear and then clamp at the same time. That helps put that negative pressure in the catheter so blood can't flow into the catheter and potentially clot in there and just ruin the IV. Then it doesn't work anymore, and that's just some plastic in someone's arm. But that's basically it. I mean, it's really easy to learn. Doesn't mean you're going to be good at it. You're going to have to practice and figure out little tricks and how it works, and just get used to different people's anatomy. But really, it's really that easy. People kind of overcomplicate it or get worried or get afraid to poke people. Like, you know, you have to learn, and you still mess IVs up because they're not always easy. But that's just the way it is. And after a while, it becomes like riding a bike. I don't even have to think about it. But you can do that too. Now this is good to go for medications or fluids. It's in a good spot. It's taped down good. It's not going to go anywhere. Just wanted to point out a couple more things because I didn't realize I was doing it while I was teaching, poking myself, and being under the pressure of the camera. But when you put this tegaderm on, usually like this, see how this outline right here? You want this part to be like right where these wings are, because this gives the window a little bit more space. I'm still covering the entire site, but that just gives it a little bit more space to make sure that area is just sealed off from the outside environment. And I didn't do that. Everyone still makes mistakes, but it's not that big of a deal right here. You could put some more tape over here to seal it down. But this window is meant to be moved up to right here. And another thing I wanted to say that I didn't say in the previous clip was when you're cleaning it, you want to make sure you give it time to dry, in which I did, but I was talking about other things. Because if it's still wet, it's going to hurt like a hell of a lot more. Because just think about pouring alcohol on an open wound. It's going to sting. And then actually when it's drying is when it gives it time to actually clean. You don't just put it on there real quick and put it in, because it's not really giving it time to disinfect the area. And that time it takes for it to evaporate is when it really does the cleaning. And that's why alcohol prep pads are 70%. They're 70% because that's enough time for it to stay on your arm before it evaporates to actually do the most optimal cleaning. And some microbiologist. I read it in a book. He figured it out. He tested out a bunch of different percentages, and that was the most optimal. So you want to make sure it's dry, and you don't want to blow on it or fan it, because that just could blow bacteria from your mouth on the site, or from the air or particles, whatever is in the air on there. So you want to make sure it's let just air dry, because even patients will try to like fan it. I'm like, no, don't do that, and just clean it again, explain it to them nicely, you know, and then they're like, oh, okay, yeah. I'm like, we'll wait. I'm in no rush. We can let this dry. But just some other tips. All right, thanks for watching. I hope this video could be helpful to you in any way. I'm going to be making some more videos on this, just random skills that I've learned in the ER, and hopefully these videos can help you if you're just learning or if you're looking to broaden your horizon. But thanks for watching.